Next speaker is Professor Gursatinder Singh, and Professor Samantha will introduce him.
I think
Professor Gursatinder Singh is known to all of you. He was the eminent professor and head of the Department of Government Medical College, Patiala for many years. He was one of the pioneers in North Zone Ophthalmic Society and a great teacher in northern India. After his superannuation, he joined AIOS Medical College near Haryana, Punjab border. We are very much happy to have Professor Gursatinder Singh as one of the leaders of Forum of Ophthalmic Teachers of India.
Thank you, Dada, and my dear colleagues and friends.
5 minutes.
Yeah, sure.
Yeah, do it fast. Thank you.
I think I don't have too many comments to make. Actually, I'm making some personal comments or observations on what transpired at 48th National Assembly in Chandigarh. There was some recommendations. I just some repetition might be there. So one of the aspects that was brought up in the first talk by Dr. Tyal was that orientation, it has to be 3 to 6 months. And in this, you make the student orientate with the department and teach the basic skills, and including and basic skills have to be taught by the good senior faculty. Actually, I think the basic skills are most important. So what happens is we leave it to the junior faculty, and then you learn the application basic skills, hands-on training in dry and wet lab. And of course, we know now the importance of dry and wet labs before we go in for surgical exposure in OT. And then, of course, the research and academics at the next stage, and then, of course, summative and formative assessment are a part of PG courses. Now, what is the, how do we standardize the teaching methods? You know, there is a need for uniform teaching method. They are not uniform all over India. Each institution has its own teaching method. And integration of practical skills with theoretical learning should be the most important objective, you know. And the use of simulation-based teaching learning method in dry lab and wet lab are essential for skill training. And a lot of institutions, they still don't have wet labs for this kind of training, which is in fact desirable. Then implementation of structured clinical training program is another aspect of it. And use of digital tools, AI-driven teaching and learning is also very important. AI can help you in a way, it can be a bane or it can be used, so you have to use it in a positive way. And simulation-based teaching modules and case-based discussions for better clinical understanding. So instead of the emphasis on the theoretical aspect, you should have more emphasis on the practical aspects, you know. And the only what I've seen over the years is that when you ask the students to prepare for seminars, so they come up with the rehashed seminars from the net, it's culled from the net, and of course then at the end of the day what you find is whatever they are trying to tell you is all from the net, you know. So I think the flip technique, you know, where you just ask the students to prepare the seminar in advance or distribute the seminar in advance to all the PGs. And the next day you have a discussion on that rather than presentation, and you ask the questions. I think that's a better modality of PG training. That's my experience. So I normally try to give them seminar a day ahead. It's distributed to all the PGs, whatever seminar is there. Then of course we discuss it in the seminar. So it's more of a question answer session, maybe moderated by even the students or PG students themselves. And of course problem solving and critical thinking. And these are different teaching methods: lectures, case-based learning, simulation, interactive sessions. And this is, I think, their relative importance. I think the lectures are, I think, the least important part of our clinical training, you know. Case-based learning, simulation, and interactive sessions, they are more important. And they should find a higher, and they should come higher in the hierarchy of, you know, different methods. Then another thing is curriculum development again. This is an exercise which has been ongoing with the NMC, and state standardization is not there, and especially PG curriculum, you know, still the competencies have not been specified, you know. So I think UG curriculum is quite, they have, you know, sort of come to some what is to be done, what are core competencies. But as far as PG is concerned, it has to be outlined, and each institution has to have their own, you know, observation on it. And of course, emerging technologies, they have to be involved in the teaching, you know, like use of AI and use of teleophthalmology and use of artificial intelligence. And then, of course, competency-based assessment tools development, objective structure training, OSCEs, as previous speaker has emphasized this. But the only thing is that OSCEs are not standardized as far as in a college. Somewhere I go and there are 10 OSCEs, somewhere there are 5 OSCEs. I think last time it was suggested you have 5 OSCEs of 5 numbers each. So all these have to be standardized. There is no standardization in this as far as OSCEs is concerned. And then, of course, assessment evaluation strategies. These are different: formative, summative, self-assessment, and peer-reviewed. And I think the formative strategy assessment is more important than the summative, because it's, I think, more ongoing process. And self-assessment is another tool. And then, of course, faculty development is another aspect which we have to look into, and has teaching and mentorship skills. So I think senior teachers have to mentor the junior teachers also. The mentorship of the teacher itself is very important, because junior teachers are more inclined to do the clinical work as compared to the senior teachers, and they are not too much into teaching. And other aspect is that senior teachers should take the onus of teaching the UGs also as well as PGs. And so this is, in fact, this faculty development would entail research training, online courses, mentorship, workshops, and of course research initiatives are required, and then of course integration of ethics and communication skills. Thank you very much.